let me welcome you. My name is Christina Hadjou. I'm a senior manager in the Office of Advancement and Alumni at the American College of Greece. And like you, I'm also a proud alumna of the school, and I'm part of a dedicated team of people that work closely with our alumni in order to create an active and dynamic alumni network around the world. We are very happy to have you here with us today. This is the fourth webinar we're organizing, especially for you, with the assistance of the leading team of the Deree Graduate School Alumni chapter. The chapters, for those of you that have not participated in the past in one of the webinars and you are not exposed to the term, are an initiative that we launched as an office back in 2021. The purpose is to offer alumni the opportunity to stay active and connected, both with each other as well as with the school, and with the students as well. At this moment, we have 7 regional chapters, as well as the Deree Graduate School Alumni chapter. And we hope in the future to have more chapters, in different countries. What we are doing is we are looking for countries and cities where we have a big alumni concentration and where we have interest from the alumni to get organized in chapters. And this is, the thing that we're using to move this forward at the time being. The Deree Graduate School chapter currently has 4 members in its leading team. It's Thanos Petsakos, Filumena Slatanu, Katerina Giannakopoulou, and Sofia Retou. Together with all 4 of them, we work toward the main goal of the chapter, which is the engagement and the networking of the alumni of the Deree Graduate School, but also of other alumni. The chapter has also cooperated in the past with the Greek alumni chapter of the school, and we have put together very nice events that you should also think about participating both in person or online as well. So before I introduce today's speaker, I would like to inform you that today's webinar is taking place on the Zoom webinars platform, which means that your microphones and your cameras are turned off. You can send us your comments in the chat, as I already asked you to do, and you can also submit your questions through the Q&A button at the bottom of your screen, and our presenter will answer all of your questions at the end of her presentation. So, I would like to introduce you to today's speaker, which is Katerina Giannakopoulou. She is a Deree Graduate School alumna, class of 2018. Katerina is a licensed psychologist and psychotherapist. She graduated from Padyon University of Social and Political Sciences in 2015 with a bachelor's degree in psychology, and immediately after entered the ACG's master's program in counseling psychology and psychotherapy. She started her career in the midst of the COVID-19 pandemic, and she worked both professionally and as a volunteer on various online platforms. Meanwhile, she worked also as a psychologist and psychotherapist at the Association of Regional Development and Mental Health, called EPAPSI, as part of the association's mobile mental health units, an initiative that aims to provide mental health services to the inhabitants of the islands of Kyklades in Greece. Katerina is a trainee cognitive behavioral therapist in Aginitior Hospital, a member of the Association of Greek Psychologists, and maintains her private practice in Athens. Katerina, thank you for having you with us today. We're looking forward to your presentation, so the floor is yours.
Thank you very much. Thank you, Christina, for introducing me, and thank you all for being here. I'm a proud Deree alumna, and I'm very happy to be in the Graduate Association, and you all gave me the chance to be here with you today, so for that, I'm very grateful. So I'm gonna start sharing my screen so that we can proceed to the presentation. Okay. Can you all see the PowerPoint?
Yes, you need to put it on the full screen.
Great. Yes, absolutely.
Thank you.
All right. So today we're going to talk about stress and anxiety. I think all of us can relate to the title of today's webinar because, as we're going to see later, we can all feel stressed and anxious from time to time. I have to give credits to our association because I discussed this topic with my fellow alumni, and they gave me the incentive to talk about this topic because it is indeed very, very related to our everyday life. So thank you guys for that. So let's proceed. And if anyone has an issue, let me know and you feel free to interrupt me. I don't have a problem with that. Okay? All right. So I wanted to do a short introduction first to a few terms because I hear it very often in my practice and in general that we are not always aware of what psychology is and what psychotherapy is. So I just wanted to take a minute to explain it to you guys. So when we talk about psychology, well, I remember myself being a bachelor student and having no idea what psychology is. So when we talk about psychology, we mean the study of the human mind and the human behavior. So psychology is an entire scientific field, and psychotherapy is part of the field of psychology, which means that not everyone who studies psychology and gets a bachelor's degree in psychology becomes a psychotherapist. They might choose a different career path. They might want to go into marketing or become researchers. It doesn't mean that they have to become psychotherapists. So in Greece, to be a psychologist, you have to complete your bachelor studies on the field of psychology and get a bachelor's degree in psychology. And then you're considered a psychologist. To become a psychotherapist, you have to do further studies, either a master's program like the one that Deree provides, or a training program that's officially acknowledged that trains you into becoming a psychotherapist. Psychotherapy is basically when people ask for help from a professional and they cooperate on an individual or a group setting. You may have heard of individual psychotherapy or group psychotherapy. And they work together in order to work on things that are bothering them mentally. So as the sketch here shows, during psychotherapy, you take a complex problem and you turn it into a simpler one with the help of a professional. Interesting fact, all of you can potentially become psychotherapists if you want to. You do not have to be a psychologist in order to become a psychotherapist. You just have to complete training studies, either master studies or training programs that make you a psychotherapist. And I've had many students and colleagues during the master's program that did not have a bachelor's degree in psychology, and yet they became awesome psychotherapists. So, bringing it back to the topic of today's webinar, anxiety and stress. So, it all started from the primitive emotion of fear. And now, I would like you to take a minute, maybe 30 seconds, not more, to read this slide here. I hope you can all see it because I'm a little bit anxious whether you can all see the presentation clearly. But if you can all see it clearly, I would like to take just a minute to read it. And if anyone wants to speak, you can tell me whether you understand anything. Don't worry, you don't have to participate. If you want to, if you would prefer to not speak, it's fine. If none of you speaks in like the next 30 seconds, I will understand that none of this is understandable. So now you can take, if you will, and again, I apologize, you can take 30 seconds, minute tops to give it a go here. And if none of you speaks, it's fine. I will continue with the presentation. I assume none of this really makes sense. So I showed you this because this is the official, let's say, explanation of the feeling of fear and the fight or flight response, which we're going to talk about in the next slide. And I was as confused as you might be right now. So let me show you the same thing in a different way. Fear is an emotion. I think you've all felt fear in your lives for various reasons. It's an emotion that's innate. There's no person in the world that doesn't feel fear, potentially. And we feel fear in order to protect ourselves from a real or perceived threat. And what does that mean? As the sketch shows here, those little fellas are confronted with, let's say, I don't know, a tiger, we can call it a lion, we can call it whatever you want. Now, they have to either fight for their lives or get out of there to save themselves. That's basically the very, very famous, maybe you've heard of it, fight or flight response. It's basically our system, our inner system telling us to either fight in order to win or get out of the situation, escape in order to save ourselves from a real threat. But we don't feel fear only when we are confronted with a beast in front of us. We can feel fear if we perceive things as a threat. So in this sketch right here, we can see a guy about to swim, okay? And at the top, in the surface, you can see a duck, if I'm not mistaken, maybe a few fish, but at the bottom of the sea, you can see sharks and whales and other creatures that we don't usually see in the Mediterranean Sea. And yet, can you imagine how many people are afraid to swim because they perceive the water as something dangerous, because they can't see what's at the bottom, so they're afraid that there might be a creature that's going to cost them their lives. And that is the meaning of a perceived threat. It's not necessarily something you have in front of you, but it doesn't mean that you're not afraid you're going to be confronted with it. So fear, as we said, is a primitive emotion that's ironically exists because it protects us from threats. Stress and anxiety are also emotions. They are not as primitive as fear. Well, we do not hunt in the woods anymore. We live in modern societies. We are confronted with different problems. We are confronted with deadlines, exams, family troubles, emotional troubles, many, many things. And we're not always afraid of those troubles, but we do feel stressed out or anxious about them. So stress is also an emotional response. It's very similar to anxiety, but if we want to be technical here, we feel stressed out usually because of something external, aka a stressor. For example, as the sketch showing, this woman here has to deal with phone calls and maybe deadlines, or I don't know, exams maybe. We've all had to deal with exams here. So you definitely know what it feels to be stressed out. Now, exams are something external, like they are going to happen. It's not something you perceive, something you think might happen. If you're a student, you know you're going to have to deal with it. And that's why you may feel stressed out. Now, anxiety has to do with ongoing negative thoughts and worries that linger even when there's no immediate stressor present. So, for example, as I said, you have to sit exams, you finish with your exams, and maybe you keep feeling stressed out. Maybe you keep thinking about your exams. You keep thinking about what kind of grade you got, whether you failed a class, whether you performed as well as you performed in previous exams. So that is basically the feeling of anxiety. You don't have to deal with anything threatening anymore, and yet you still feel stressed out. We have to clarify here that in English, stress and anxiety are more easily, let's say, separated. But in Greek, we usually use the word άγχος. Είμαι αγχωμένος, είμαστε αγχωμένοι. It's more common to use that word. So in Greek, there's no clear distinction between stress and anxiety, but I just wanted to be very thorough here and give you the actual explanation of each term. So, would anyone like to share? I don't know if you like this part of presentations, but I like it, so I integrated it and we'll see how it goes. Would anyone like to share anything that makes you feel stressed out or anxious currently, in the past? Maybe something you're expecting to happen, anything you want.
Yeah,
You don't
just
have to
write it
share.
in the chat box. Yeah.
Sure.
Yeah.
Okay.
So you can read it from the chat box unless you want me to read them.
I can see a
Okay.
few answers, yeah.
Mm-hmm.
Public speaking, the news. I feel you. Having to find and move to a new apartment, that's really good. Been there. Human relationships, yeah. Oh, public speaking. Yeah, me too, which is very ironic that I'm doing this right now. You can't imagine how stressed out I was now with the whole share screen thing. Thank you very much for participating, by the way. So you can all relate to this feeling. It's very common. All of us feel it. And again, the irony of the situation is that anxiety, stress, fear, whatever you call it, exists to protect you from something that feels threatening. The problem starts, see, when anxiety stops being, let's say, within normal levels and it becomes excessive. That means that there is such thing as normal anxiety or low anxiety. This diagram here, I don't know if you can make sense of it, but we'll explain it. So I think we're going to be fine. It shows the anxiety levels a person can have and the good versus bad anxiety. And what does that mean, basically? Because anxiety is biologically programmed to exist and is here to protect you, it can also have positive effects, meaning you wanna, I'll tell you actually an example of mine. I wanted to participate in a literature contest. Now, to participate, I had to write, which makes me very nervous for some reason. But because I really wanted to do this, I started feeling anxious, but this anxiety actually pushed me to keep writing in order to participate in the contest. So now we talk about normal anxiety. And when we have normal anxiety, you can see that we have higher functionality. So anxiety can push us to be creative. We have creative anxiety, for example. It's the kind of anxiety that brings you ideas, that makes you want to finish before your deadline, that makes you want to do things, that makes you want to not be static. That's the kind of functional anxiety. Now the problem starts, and by the way, as you can see, low anxiety equals lower functionality. If you have no anxiety at all, that means that you're unbothered by anything. And I know this sounds ideal right now, but it means that you may not be pushed into doing things. The problem is when anxiety becomes excessive, and as you can see, functionality drops. So yes, there is good and bad anxiety, and in psychotherapy, and as we're going to talk about later, when we talk about anxiety disorders, we talk about excessive anxiety. So just to give you a brief summary of what psychology considers anxiety disorders, I'm just giving you a list of the current version of the DSM. For those of you who don't know, the DSM is a diagnostic and statistical manual of mental disorders. It's our Bible, both for psychologists and for psychiatrists. And it pertains basically all the mental disorders that have been acknowledged officially so far, at least. I don't want to trouble you with the specifics. I'm just giving you a for instance here of what anxiety disorders are. We're not having a psychology seminar, so I don't want to get into the details of each and every single one disorder. What I can tell you is that all of us may have experienced symptoms that have to do with all the disorders you see here. That doesn't mean that we have them. It just means that we have symptoms of them, and that's very, very normal. In order to have a disorder, you have to fulfill specific criteria that have to do with for how long you have them and how intense they are, and whether they interfere with your everyday life. That's the only situation when we discuss about disorders and having a disorder. And that goes for any disorder and not just anxiety disorders. To be simpler, how does anxiety manifest? In many ways is the answer. And there's no particular answer. What I can tell you for sure is that in psychotherapy, usually we believe, and we have found out after extensive studies, that anxiety, and that goes for any disorder actually, has many causes for manifesting. So there's not just one cause that brings you to an anxious state, for example. And what do I mean by that? It means that in order to feel any kind of mental difficulty, the biology, the psychology, and the social model, they all work together, meaning it has to do with whether there's comorbidity with, I'm sorry, not comorbidity, but whether there's hereditary reasons. For example, maybe a parent or close relative had also a disorder that may or may not know they have, but that usually plays a role. The psycho part here has to do with your personality. We do not have the same personality. Each and every one of us are different, which is why we may be diagnosed with the same disorder and we will not manifest it in the same way. And the social part has to do with your environment, how you grew up, which school you went to, what kind of life events happened. Basically, everything that's happened in your life and the environment you grew up in. So both biology and your personality and environmental factors play a role, and they actually determine any kind of mental difficulty you might feel. So this is just an FYI on the causes of mental difficulties. And I'm saying difficulties and not disorders, again, because having difficulties with anxiety doesn't mean you have an anxiety disorder, for example. How else does anxiety manifest? I think we can all attest that we've had many negative thoughts, either in the past, in the future, or in the present. Negative thoughts or automatic negative thoughts that have to do with various things are very, very present when you're anxious. And I'm going to give you an example. I'm taking you back to the exams. I think many of us have thought things like, how am I going to make it? Do I have enough time to study? What kind of grades am I going to get? Am I going to do well? Is it going to be enough? What if I fail? All those thoughts are negative thoughts you can't say that they're positive, and they come automatically without you controlling them. And that's the difficult part with anxiety. It causes many, many thoughts that you feel are out of control. Many of you have mentioned public speaking. You can't control negative thoughts that have to do with public speaking. For example, you just feel very stressed and you feel like maybe it's not going to go well. You think that maybe you're going to forget your words, that maybe you're going to mess it up. And that just comes automatically. And that's a very, very characteristic part of anxiety. Very, very characteristic are also the physical symptoms. Some of them are restlessness, feeling on edge, maybe during a specific period of time or all the time, feeling easily fatigued, having difficulty concentrating, feeling your muscles very tense, maybe having trouble sleeping. All those can be, assuming that there's no medical condition involved, they can be symptoms of anxiety. Now, anxiety and panic are two different things. Panic, what we call a panic attack, is, let's say, the pinnacle of the anxious state. Panic attacks are very, very short in duration, usually, although it feels like forever. For any of you that might have had panic attacks, I think you can tell that it feels like you have them forever, but actually they last a couple of seconds or maybe 1 or 2 minutes, not more than that. It's just that they are so intense that it feels like they're never ending. And if you're having a panic attack, you usually feel heart palpitations, your heart's beating like crazy, you're sweating, you feel dizzy, you feel numb, you feel like you can't breathe, like the air is kind of, there's a lot of air constipated in your chest, maybe chest pains, maybe you feel like you're choking or like you cannot swallow, maybe you feel nauseated, you have this intense fear that you're dying or that you're losing control of your mind, you're going crazy. That is a panic attack. And it's different from an anxiety attack because it's usually way more intense. So panic disorder is a little bit different. Panic disorder means that after you've had a panic attack, you start feeling worried that you're going to get another one and another one and another one. And that, ironically, gets you into panic mode again. If that pattern is persistent, that's when we talk about a panic disorder. But not all of us who have had panic attacks means that we have the disorder. And all of us can potentially get panic attacks. And as for behavioral symptoms, the main symptoms that we see in terms of behavior is avoiding something or procrastinating. Now, when we say behavior, we mean anything we do, from sleeping to talking to moving around. That's what we mean when we say behavior in psychology. And procrastination or avoiding to do something that makes you very, very anxious is like at the top of the symptoms we see during if you feel anxious. Again, all those symptoms depend on the person. There are people who are anxious, but because they're anxious, they want to get things out of the way and get them done. There are other people who just procrastinate until the last minute and until they have no choice but to face their deadlines, for example. So I want to take a few minutes to talk to you about the cognitive behavioral model for anxiety and cognitive behavioral therapy, not only because I am a cognitive therapist myself, but because this model has been specifically developed for people who are suffering from depression and anxiety. So this is the main reason why I want to talk to you about it. We're not going to dwell on it because we're not being trained here to become psychotherapists. but it does give you a nice idea of how us psychotherapists who study CBT work with people who suffer from anxiety. So, what is cognitive behavioral therapy? Cognitive behavioral therapy focuses on understanding the way that people think. And what do I mean by that? There was a very, very wise man called Epictetus, or Epictetus, and he was a philosopher. I think he was a Stoic, correct me if I'm wrong. And Epictetus said back in the day that man is not worried by real problems so much as by his imagined anxieties about real problems. And what does this mean? It means that all of us may be faced with the same situation. And because we're all Deree graduates, I'm gonna again use the example of the exams. So we may all have to study and sit on our exams, but I'm pretty sure that none of us are gonna interpret those exams in the same way. Some of you may feel more relaxed, more sure about themselves, and you may not dwell into what's gonna go wrong. Others may feel very anxious. You may feel like it's too much, like you haven't prepared, like you don't have enough time, and that everything's gonna go wrong. Why is that? Because we do not interpret things the same way. We do not think the same way. We have different thinking. So CBT is saying, okay, so instead of focusing on the exams, for example, and whether your professors gave you difficult or easy topics, we are going to focus on how each and every one of you interpret the fact that you have to sit the exams, because that's where the issue is. If you interpret the exams as something so monumental that it's going to define the way you see yourself and your self-worth, then that's what we have to discuss. That's what we have to process. The exams may or may not be difficult. That's also subjective. So that's not the point. The point is how you take it. So in CBT, we don't really care about the stimulus. What is the stimulus? Is, well, basically anything that happens around you. We care about the cognitions, which are basically your way of thinking, your belief system, what you believe about yourself, how you see yourself, if you feel that you have self-worth, if you keep thinking negatively, if you keep thinking positively, all those beliefs, your core beliefs and your thoughts, they determine the way you respond, and here's the response part, you respond to your everyday life, to your duties, to your responsibilities, and to the people around you, to yourselves. Your thoughts are what determine your responses. So this is why CBT focuses on the thinking part, not the stimulus part. So this is a different way of seeing the CBT model. I have it both in Greek and in English, because in Greek, it's called τα τέσσερα sigma, because it's σκέψη, σώμα, συναίσθημα, συμπεριφορά, 4 S's. In English, it doesn't translate this way, so that's why I included both. What does this circle here show you? This circle here, cycle, if you will, shows you the vicious cycle of anxiety. We start with the stimulus, i.e. exams. This stimulus brings certain automatic thoughts. You may not be aware of them. You may feel first, for example, physical symptoms. You may understand that, okay, I'm anxious right now, because you feel your stomach hurting, you feel maybe a headache, you feel nauseous, you feel your muscles very, very tense. It may start from here, but there's always thoughts that have preceded all those emotions. So going back to the exams, the thought may be that, oh my God, I'm not gonna do well. This will bring physical symptoms like i.e. Headache, stomach pains. This, I'm sorry, let me go back. This will bring certain emotions, anxiety, stress, fear even. And this will lead to certain behaviors. For example, procrastinating and maybe starting to study the night before. I don't know if that's possible when it comes to Deree classes, but yeah, it could happen. So this is a vicious cycle that keeps happening and over again. And what does CBT say? Okay, so if we intervened here, if we helped you think differently about those upcoming exams, would the entire cycle change? Would your physical symptoms be less? Would you feel less stressed out? Would you not procrastinate till last minute and maybe start studying a little bit earlier so that it doesn't feel very, very overwhelming in the end? Maybe, probably. Studies have shown that yes, this model works. So that's why we focus on this part right here, the thinking part. Those are the 5 stages of CBT treatment. I've included them very briefly. Usually we make for some introductions and we focus on helping the client familiarize both with the relationship, the therapeutic relationship, getting to trust the therapist, and with the way CBT works so that the client is aware of how we're going to work. The next step is to train the client into observing themselves. And what does that mean? It means starting to look at yourself as if you're standing in front of yourself, trying to separate from the issue and observe yourself and observe the way you think. Now, CBT has found that by doing exercises and writing down your thoughts, for example, really helps you into actually being aware of them, being aware of their existence. You cannot imagine how many thoughts go through your mind and you're not even aware of them because they happen very fast. And that's the mind's work. The mind exists in order to think. But there are certain thoughts that linger, we are not even aware of them, and they cause problems. So CBT says, okay, start writing down your thoughts so you start learning to observe them and become more aware of them. Then we move into behavioral interventions, which is basically creating certain experiments. And those experiments differ. They have to do with, let's say, the symptoms. For example, if someone is very afraid of close and confined spaces, like an elevator, one experiment could be to start taking the elevator with a therapist present so that the therapist can create a context of trust and support. And at first, we're going to go to the first floor. Then when we achieve that, we're going to go to the second and the third and the fourth. And this way, you start to face your fear and work on it. In terms of exams and studying and being very worried about that, CBT therapists can help you create a realistic studying program and create and set realistic studying goals that can help you study better. And I know it sounds a little bit directive, but those experiments have really helped with people with facing their thoughts and facing their fears and not avoiding them. Then the last and hardest stage is to help the client figure out different ways of thinking. As we said, it's the thinking patterns that cause the problems. At least that's what CBT believes. So after having learned to observe yourself and observe your thoughts and acknowledge that you have certain negative thoughts that make it difficult for you to function, then we have to challenge them. We have to find different ways of thinking. So CBT is saying, okay, we've established the fact that you think you're useless. And yes, there are people who actually think that. We've established that. You know it, I know it. Is there any way that you can see things differently? And that doesn't mean seeing things positively. We are not looking for the positive aspect of things. Like, oh, you're stressed out. Well, don't be stressed out. Life's nice. Life's good. It's fun and it's full of flowers and greens and nice scents. No, this is not the way to change the way you think. No, we're talking finding realistic ways of thinking that are not entirely negative. So, for example, what evidence do you have that that make you believe that you're completely useless? Are there things you have achieved in your life that suggest something different, etc., etc.? And then if that level, if that part here, that stage here is achieved, we move to the termination and the completion of therapy, which is basically the fact that you can become your own therapist. We do not want to keep you forever, especially CBT is considered one of the briefest types of therapy. It's usually 25 to 30 sessions. And the goal is to take all the techniques and all the exercises and all the ways of thinking that you've learned and implement them yourself in the present, or if you're faced with other adversities in the future. That's the goal, to learn how to think differently so you can do it yourself and implement that in anything that happens in your life. Well, at least that's the ideal goal. So we talked about navigating the storm, and that's the title of today's webinar. I know that there's a lot of information online, there's a lot of applications, a lot of stimuli out there, a lot of lists that tell you, you want to tackle your anxiety, you have to do those 5 things. Unfortunately, I don't believe in that. And what do I mean by that? There's no magic recipe. There's no manual that tells you that if you do those 5 things, you're going to stop being stressed, you're going to stop feeling anxious. And that's why what I showed you in this presentation, under no circumstances does it substitute the therapeutic process. It's just a few introductory things and a few information that help you understand that there are ways to actually deal with your anxiety if you seek professional help. So, in my opinion, in my personal and professional opinion, and now I'm speaking both as a person, as a human, and as a psychologist, one very, very useful thing to do to help yourself is to observe yourself. What is bothering you? Has something changed in your behavior? Do you feel different? Did you used to feel better than you feel right now? Can you deal with what is happening to you right now? And why do I highlight the part of right now? Because we all go through phases in life. We all go through stages. Not all phases are the same. Maybe in the past you were more capable and more, you had a lot more stamina, mental stamina, and a lot more strength to face your adversities, the adversities that befall you. But maybe in the present, you're tired, you need some help, you feel more lonely. All those are parts of life. They are all human and normal. And it doesn't mean that because in the past you were, let's say, more able to talk in public, now that you're more anxious of it, you're less worthy or you're helpless. No, it's just that it's not the same phase of life. So if you're able to acknowledge that and not deny it, that's really useful for you to understand whether something's wrong and whether you need help. Something that's also useful is to listen to the people you trust around you, your family, your friends, your significant others, people that have a positive influence on you. If those people give you feedback that maybe something's changed, that maybe you've changed, that maybe they see something that's going wrong, you can listen to that. You can ask them what they mean by that, because of course they're not professionals, but it doesn't mean that they don't know you. So you can take that into consideration. And finally, you can always ask for help. That doesn't necessarily mean professional help. And what do I mean by that? Of course, if something feels too much to handle, it's always useful to ask professional help. But during psychotherapy, us psychotherapists always ask, what's your environment? What's your support system? Do you have one? Do you have people around you that help you? Do you have people around you that you can have fun with? Friends, family, significant others? Because all those people play an important role in the way you feel. And everything is useful, from spending time with your family, to going out with your friends, to talking to them, to talking to the people you may be in a relationship with, to have fun with them as well. All those factors help deal with anything that's difficult in life. So aside from our profession, which of course is very, very useful, your environment plays a big role in everything. So, because we're almost towards the end, I thought that it would be nice to show you a very, very helpful technique. It's the breathing relaxation technique. It's basically, I don't know if any of you have done yoga or Pilates or any form of exercise that has to do with mindfulness as well, and controlled breathing. So it's basically the same thing. And breathing techniques are actually very helpful when it comes to dealing with anxiety, fear, panic, and even physical pain. And why is that? Because usually when we're anxious, we tend to breathe faster. So this is why we feel that the air is trapped inside our chest. Many times we may feel that. So by changing the way we breathe, we can actually kind of release our chest, bring more oxygen to our brains, and think clearly. And also the physical symptoms that we may feel, like restlessness, dizziness, chest pains, they also dial down as well. So because breathing is easy to practice on your own, I decided that this would be the most suitable exercise to show you in a webinar setting. And my idea is to do the breathing technique myself, and show you how it's done so you can all try it yourself. For this to happen, I have to stop the presentation so you can see me. So I'm thinking of stop sharing the screen so you can see me and I can show you the breathing technique. Am I saying this right?
Yeah.
Okay, cool.
Stop sharing. Yeah.
Okay. So I got it. I think I mastered it. All right. So I hope you can all see me. You have your cameras closed, shut off, so from what I know. So you don't have to do it. You don't have to participate. I can only do it, and it's fine. And whoever wants to do it, I'm not gonna see it anyway, so don't worry. There's no way of doing it wrong. So when we practice breathing, I have found it very helpful. I may have to stand up for this. I have found it very helpful to put one hand on your chest and the other hand on your belly. And why is that? Because we have to practice breathing from the diaphragm, which is right here. And because usually if you think about the way you breathe, you usually breathe like this, like from the chest. And especially when you're stressed out and breathing becomes faster, your chest may go up and down faster as well, and that may get you dizzy. So what we want to do is redirect the air, let's say, and start breathing from our diaphragm like babies do, if you've observed that. you can see babies' bellies going up and down, and that's because they breathe from the diaphragm. And that's what we want to do. So if you have one hand here and the other here, you can feel from your hands whether you breathe from your chest or from your belly. So what do? We mentally count from 1 to 3 when we inhale, and from 1 to 4 when we exhale. We always inhale from the nose, and we always exhale from the mouth. And when we exhale, we take all the air off like this. So, how do we do it? I can't count and inhale and exhale, so I'm gonna do the breathing first, and then for whoever is practicing at home, I'm gonna count from 1 to 3 and from 1 to 4 for the exhaling, assuming that some of you might be trying it right now. So when you inhale from the nose, and you feel your belly like going like this, like when the belly is full of air, it kind of pops out. So you want to feel that. And when you exhale from the mouth, you want to feel it go back in because you take all the air out with force. So it goes like this. I'm doing it one more time. I don't know if it was very visible. You may feel a little dizzy at first because you try to do it correctly, you may get more air into your lungs and you may feel a little dizzy. Don't worry about it. You're not going to faint or anything. You just stop the exercise, breathe normally, and start from the beginning. So, assuming that some of you might be trying it right now, I'm going to count from 1 to 3 for the inhaling and from 1 to 4 for the exhaling one time. And that's it. So, you inhale from the nose. 1, 2, 3. Exhale loud. 1, 2, 3, 4. Want to do it one more time? Let's do it one more time. So, inhale from the nose. 1, 2, 3. Feel your belly full of air. Exhale loud. 1, 2, 3, 4. I can't see you, but I'm very happy if you tried it. You can do it by yourselves. You can do it at home. If you master it a little bit, you can do it without the loud exhaling part anywhere you are. Like, for example, if you're in a public space, you can do it like this. Then no one can notice. No one will notice. Because it really, really helps with your heartbeat. Your heart goes slower. Your breathing is more normal. And finally, your brain, your mind is clearer. So I highly suggest it personally, and because I assume there's many women here, I use it for menstrual pains as well. It's very, very helpful. So I hope you liked it as well. Thank you very much for listening to my presentation. That was it. As for the technical issues, I blame my laptop. So for anyone who may have questions, of course, I'm here to oblige.
Yes, you can put your questions in the Q&A section or in the chat, whatever is preferred. Sure. So we're looking forward to it.
Oh, thank you.
Is it?
Thank you. I know I have to say, I have to make a short disclaimer here. Anxiety and stress is a huge topic. Not all people experience it the same, so we could be talking for ages. It couldn't be concentrated into one presentation, but I tried to do my best.
Okay, I continue saying thank you.
Sure.
Yes, we will share the slides. Yes.
Caterina, I think we're not done here. I think we have to arrange a follow-up session soon.
Of course. I'm here and I'm willing, and your master, what steps did you take to engage with CBT? Oh, that's a painful topic. But we can talk about it. Yeah, therapy for OCD. Okay, well, about the OCD question, yes, CBT is also very suitable for OCD. Imagine OCD back in the day was considered part of anxiety disorders. But now with the new DSM, it's a whole chapter on its own. But CBT is very helpful with OCD because it helps with those very, very freaky and intrusive thoughts that come uninvited. And CBT helps you control them. So I would highly suggest CBT for OCD. How do you explain to someone that has experienced anxiety and panic, and how do you help them understand it? Okay. I'm just taking a look at everything you've written down. I'm sorry. Oh, wow. You think you're more capable of helping your students now. This is the highest compliment the biggest compliment I can get. Thank you. Okay, so how to explain to someone that hasn't experienced anxiety and panic, and how do you help them understand it? Well, I hope this webinar helped a little bit with what anxiety is and what panic is. Usually I help them understand with examples of their own. So I ask them to think of something that has happened in their lives that it may be minor. It may be crossing the street. It may be I was watching TV and suddenly I felt anxious. Anything, we can use it. And I ask them to share that. And we do the cycle that I showed you in order to show them how thoughts interfere with feelings and our bodies and our behaviors. And there's a very specific, even more specific model we follow for panic disorder and panic attacks. And ironically, because I personally believe it's one of the worst things that can happen to you at the time that they happen, ironically, it's the first thing to go away when you start working on it. They are so intense and yet very easy to deal with if you deal with them properly.
Okay, Katarina, we also have one question in the Q&A. So
Sure.
the question is from an anonymous attendee, and it goes like this. How do I differentiate between normal body things like stomach aches or fast heart and anxiety stomach aches and fast heart?
So whether it's a physical issue or a mental
Or
one.
yeah.
Yeah, well, you can't. I mean, what do I mean by that? We always tell clients, we always ask them for their medical history. Because when you have physical symptoms, the first thing you have to exclude is the physical part, whether there's a physical condition. We're not doctors. We cannot assume that we're doctors, and we cannot assume that everything you feel has a mental cause. So if there's a symptom that you're feeling, say stomach pains, and it's persistent, we would ask for you to get it checked out, rule out whether it's medical or not, and then we can talk about psychosomatic symptoms.
Okay.
Okay.
Another question from Eva Kiprianou. How much time does OCD takes to be cured with CBT?
Yeah, so cure is a strong word. OCD in particular is I consider one of the difficult conditions one might deal with. The thing is, and well, I may be a CBT therapist, but doesn't mean I agree with everything CBT does. It's very brief. So many times we see that we may have completed like the 25, the 30, even the 40 sessions if need be, and then people come back because it's not enough. So it's not about curing OCD with CBT, it's about helping you deal with it on an everyday level. Because OCD has this particular characteristic of intrusive thoughts that may be triggered when you're stressed out in general with something in your life. you may feel pressured in any way, and that's when the intrusive thoughts manifest again. And you may have the compulsions as well, and it's a more complicated issue. The point is not to cure it, but to help you understand what's going on and learn how to deal with it. Because what we always say is that there's no point in saying that you should not think this way, you should not put this thought in your brain. No, it's like having an elephant in the room and asking you to not look at it. No, if the thought comes, it's gonna come, but you have to not pay attention to it. And that's what we teach in CBT when it comes to OCD, and how you can do it by yourself when it reoccurs and reappears.
Okay, great. Thank you, Katerina. There is another comment in the chat from Rodiani Voreadou. The presentation was very well organized and complete, and she's suggesting a couple of web pages to
Yes.
complement today's information. I'm not sure, how much you're familiar with the websites. They have to do with breathing to reduce stress, from what she says.
I don't know these particular ones, but there are many instruments online that you can find that can help you with breathing techniques and other techniques as well. As long as they're verified, they're always useful. Thank
Yeah,
you. I'm
sure.
gonna take a look at them actually.
Okay, and I see one last question from Anna Kanalopoulou. During the periods of depression, when you also take medicine, can CBT help you deal with the incredible anxiety and the unstoppable thoughts?
Well, CBT as a model has been developed specifically for anxiety and depression. So theoretically, of course, it can help you. And we always suggest that psychotherapy should accompany the medical part. Like if you both take medicine and do psychotherapy, that's what studies have shown brings you the utmost results. But again, I don't want to sound arbitrary here in the sense that not all people prefer CBT or any other approach. What matters is for you to find the approach that works for you. So yes, CBT can work when it comes to depression and anxiety. That's what it's made for. But if you don't go for it, if it doesn't like work with you, then that's what matters. The point is to help you and not to do it and not to do CBT just because it's known to help with anxiety. The point is to find what helps you in particular, and we're all very different. So there's not one rule. But yes, theoretically, it can help because that's why it was designed.
Perfect. I don't see any other questions.
Okay.
So thank you all so much.
Thank you. Thank you very much.
Yeah, I think that we are ready to
Was
close.
one about what made me go to CBT after my master's program, if I'm not
Yeah,
mistaken.
sorry. Yeah, it was
No,
that
that's
was the
okay.
first.
It's okay. It's okay. I don't know if Alexandra is still with us, but what made me go into CBT? Well, I loved Deree, and I loved the fact that our master's program had every approach in it. We got in touch with CBT, we learned a little bit of psychoanalysis, a little bit of systemic psychotherapy, person-centered, client-centered, you have it. It was 3.5 years, it was intense, I loved it. But out of all these approaches, I chose CBT because I thought it was more evidence-based, more scientific, and it can give you a lot of tools that you can use in different ways as a therapist. Because you can learn the theory, but you can apply it in a way that works for you as a professional as well and works for the client. And I thought that CBT can do that. And I very much agree with the idea that the way you think really, really influences everything in your life. And if you start thinking a little bit differently, you may see things a little bit differently. So it was the theory of it that made me get into it.
Okay.
But again,
Great.
this is very subjective.
Okay, I
Thank
just
you,
see
Thanos.
comments there. You can read the comments. They're very
Yeah,
positive.
I saw Thanos's comment as well. Thank you very much. Thank you.
Okay, so as I said, I think that we can wrap it up for tonight. You know, to also be considerate of the people that are participating. Since it's almost 8:15. So thank you all for participating today. We hope you enjoyed it. A big thank you to Katerina. We're grateful for your presentation, and to
Thank you.
Thanos, Filomena, Sofia for the great
Yes.
collaboration that we have. My two colleagues that are joining us here today, Dimitris Toubis, he's the Executive Director of Advancement and Alumni, and Tina Roumiliotis is the Senior Coordinator of our office. For those of you that would like to get actively involved in the Deree Graduate Alumni chapter or any other chapters of the college, please feel free to contact us. Any of the three of us, you know, will be able to help you in finding ways that you can participate. There will be a follow-up email. As we said earlier, we will share Katerina's presentation along with all of our contact details. You can also find us on ACG Connect. ACG Connect is our online platform that you can use for finding out the news of the school, the job postings that we're making, the alumni mentoring program, and many more programs that we offer to you. The link to connect is acgconnect.org, and those of you that have not already registered, we strongly advise you to do so, because through that you will be able to find all the activities that we do, both with the chapters as well as like an office of ACG. Let me wish you a great evening. Thank you again, Katerina.
Thank you
We
very
hope to
much.
have you with us, you know, in one of our future events as well. And it would be great if we could also meet in person in one of our upcoming events taking place up at the school. So good night to everyone.